Your infant is teething. Know the signs and symptoms. Everything can be a time of great frustration for caregivers. In this post, I will list some of the most common symptoms, explain how they relate to teething, and share some insight on how to help soothe your little one during this potentially uncomfortable time. When does teething begin for infants? Teething usually starts around 4 to 8 months with the lower front teeth and continues until 30 to 36 months of age when the last set of molars appear. During the teething period there are symptoms that include irritability, disrupted sleep, swelling or inflammation of the gums, drooling, loss of appetite, rash around the mouth, mild temperature, diarrhea, increased biting and gum rubbing, and even ear rubbing. These symptoms were reported by 70 to 80% of parents according to an article from the British Dental Journal. So, why don't all infants experience teething symptoms? Keep reading to find out. Why teething symptoms may be confused with cold symptoms. Research has pointed out that teething begins around 6 months of age. This is the same time when an infant's immunities they received from their mother, via the placenta, are diminishing. This means that the infant's own immune system is becoming established. During this time, infants become vulnerable to minor infections. Because these two changes are taking place, the symptoms of teething can be confused with a minor illness or cold and vice versa. This explains why only 70 to 80% of parents reported teething symptoms of their infant. It's very likely that parents of the remaining 20 to 30% associated the symptoms to a minor illness or cold. Below is a list of commonly reported teething symptoms, with ways to help your infant at home and when to call the doctor: irritability, drooling, skin rashes, coughing, biting and gnawing, low-grade fever, cheek rubbing and ear pulling, diarrhea, irritability. This is caused by the discomfort of the teeth erupting through the gums. Often the first teeth and molars are the most uncomfortable. How to help your infant's irritability: cuddle, cuddle, cuddle. Every baby can use some good cuddle time when they are having a hard time with teething.